Now recognize the gentleman from New York, Mr. Langworthy, for his 3 minutes of questioning.
Thank you very much, Mr. Chairman, and I'll kind of cut right to the chase. I mean, this is my first term on the Energy and Commerce Committee. I've had an awful lot of healthcare meetings, and some of you have been by the office. But I ask every stakeholder that comes, why is healthcare increasing so drastically compared to other facets of the economy? Who's at fault? And the amount of finger pointing, but, you know, if the hospitals are there, it's the insurance companies. Or if it's the insurance companies, it's because of pharma. If it's pharma, it's because of the insurance companies. And we need to get to the bottom of why premiums have exploded on Americans over the last 10 years, and more drastically in the last 2. And what is driving these costs? And what I think is important for us to be aware of is, what is each of your dedication to the bottom line with the bottom line cost to the taxpayer, to the consumer? Because, I mean, we are obviously shoveling trillions of dollars at the healthcare system in America, yet prices are exploding. Now, some of my colleagues want the government just to pay for this for everyone, and that's what they think is the best ultimate solution. You heard several mention that. I believe in the American healthcare system. It is a free market system because I think that leads the way in innovation to get us the best outcomes. So, Mr. Helmsley, what is United Healthcare specifically, not generally, doing right now to lower premiums for its customers?
Thank you, Representative, for the question. We are intensely focused on managing costs.
You need to keep these answers short. I mean, is there a specific
costs,
action that you guys are
coordinating
taking?
care, using data and insights, and value-based care as the key to change the whole direction of healthcare towards a value-based outcome system and less towards a volume-based system.
Okay. Mr. Joyner, what is CVS specifically, not generally, doing to lower premiums for its customers?
Yeah, today, we believe that the single biggest issue is the health status of the population. They're aging, consuming more healthcare resources. So our focus is on wellness, prevention, keeping people out of the hospital, keeping people on low-cost therapies that we believe will ultimately manage the overall health costs, and like United Healthcare, focusing on an outcomes-based model with the provider. So we're working collaboratively and introducing technology to help bring the consumer into the process.
Ms. Bordeaux.
Thank you. Congressman, we have 2 core strategies. One, in our company, reduce overall healthcare costs and simplify the system. I'd offer 3 practical things. One is, as we've shared, improve and streamline the prior authorization process to take complexity out of the system for members and care providers. Second, investing in fraud, waste, and abuse to take unnecessary costs and make the premiums go to the right things. And the last thing is, I share with my colleagues, continuing to invest in paying for value and outcomes to make people healthier.
Okay, my time has expired, so I will yield back, and if the rest could respond right.
Gentleman is yielded back, and now recognize